Your doctor may have checked the joints in your knees during your last appointment. They may have ordered an X-ray, asked whether you experience pain while walking, and perhaps even suggested that arthritis is simply part of getting older. They may have recommended pain medication, discussed weight management, or encouraged you to remain physically active despite the discomfort. What they may not have fully explained, however, is that for many adults over the age of 60, the pain that forces them to stop walking after a certain distance is not actually beginning in the joints at all. In many cases, the real problem develops inside the blood vessels responsible for delivering oxygen-rich blood to the muscles of the legs. By the time the pain becomes severe enough to limit daily activities, the biological process causing it may have been progressing silently for years. People assume that leg pain during walking must originate from the muscles, bones, or joints because those are the structures where the discomfort is felt. The logic seems reasonable. If your calf hurts, the problem must be in your calf. If your thighs burn after walking a short distance, the muscles themselves must be weak or damaged. Yet the human body is far more interconnected than most people realize. Muscles depend on oxygen. Oxygen depends on blood flow. Blood flow depends on healthy arteries. When one link in that chain begins to fail, the symptom often appears somewhere entirely different from the underlying cause. This is why so many people spend years treating pain while never fully understanding what is creating the pain in the first place. My name is Dr. Kaivor, and I have spent much of my career studying preventive medicine, healthy aging, and the physiological changes that influence mobility later in life. Today, I want to discuss one of the most overlooked causes of walking-related leg pain in older adults, explain the mechanisms that drive it, and show you why one of the most effective interventions requires no equipment, no expensive treatments, and no complicated exercise programs. Before we begin, however, I want to make something absolutely clear. Not every form of leg pain is caused by the condition we are discussing today. Arthritis, nerve disorders, spinal problems, injuries, and many other medical issues can produce similar symptoms. The purpose of this discussion is not self-diagnosis. The purpose is understanding. Because when you understand why pain occurs, you become far better equipped to address the underlying problem rather than simply reacting to the symptom. The condition I want to focus on today is known as peripheral artery disease, often abbreviated as PAD. Despite affecting millions of adults worldwide, many people have never heard of it. To understand peripheral artery disease, imagine the arteries in your legs as highways carrying oxygen-rich blood from your heart to your muscles. Every time you stand, walk, climb stairs, or perform any physical activity, your muscles require increased amounts of oxygen to generate energy. Under normal circumstances, healthy arteries expand their delivery capacity to meet those demands. Blood flow increases, oxygen arrives where it is needed, and the muscles continue functioning efficiently. The system works so effectively that most people never think about it. The problem begins when plaque starts accumulating inside the arterial walls. Plaque is composed of cholesterol, inflammatory cells, calcium, and other materials that gradually build up over many years. This process, known as atherosclerosis, causes the arteries to become narrower and less flexible. At first, the narrowing may produce no symptoms whatsoever. The body is remarkably adaptable, and minor reductions in blood flow can often be compensated for without obvious consequences. However, as the narrowing progresses, a critical threshold is eventually reached. The muscles begin demanding more oxygen during activity than the arteries can supply. At that point, the symptoms become noticeable. What makes peripheral artery disease particularly deceptive is that the pain often follows a very specific pattern. A person may begin walking and feel perfectly fine for several minutes. Then, after a predictable distance, discomfort develops in the calves, thighs, or buttocks. The pain may feel like cramping, tightness, aching, or burning. If the person stops walking and rests for a few minutes, the discomfort gradually disappears. Once they begin walking again, the pain returns. This cycle can repeat itself over and over, creating a pattern that physicians recognize immediately, but that many patients misunderstand completely. The reason this pattern occurs becomes clear once you understand the underlying biology. When the muscles are resting, their oxygen requirements remain relatively low. Even narrowed arteries may be capable of delivering enough blood to satisfy those modest demands. Walking changes the equation. As muscle activity increases, oxygen consumption rises dramatically. Healthy arteries respond by delivering additional blood flow. Narrowed arteries cannot. The muscles effectively enter a state of temporary oxygen deprivation. Waste products begin accumulating. Metabolic stress increases. Pain signals are generated. When the individual stops walking, oxygen demand falls once again, allowing the limited blood supply to catch up. The pain improves not because the underlying problem has disappeared, but because the demand has temporarily decreased. Research has consistently shown that peripheral artery disease becomes increasingly common with age. Risk factors such as smoking, diabetes, high blood pressure, elevated cholesterol, and chronic inflammation accelerate the process, but aging itself remains an important contributor. What concerns physicians is not simply the discomfort caused by PAD, but what the condition reveals about overall vascular health. The same biological processes narrowing the arteries in the legs are often affecting arteries elsewhere in the body as well. In many respects, leg pain during walking can function as an early warning sign that the circulatory system deserves closer attention. I remember a patient I will call David, a 70-year-old retired contractor who first came to see me because he could no longer enjoy one of his favorite activities. For decades, he had walked several miles every morning without difficulty. Over time, however, he noticed that a cramping sensation began developing in his calves after approximately 10 minutes of walking. Initially, he assumed the problem was related to aging muscles. He purchased new shoes, tried stretching exercises, and reduced his activity level. None of these changes helped. The distance he could walk before experiencing pain gradually became shorter and shorter. Eventually, even simple errands required frequent stops. What made David's situation particularly frustrating was that he felt healthy in every other respect. He had no major joint problems. His balance remained good. His energy levels were relatively normal. Yet walking, one of the most fundamental human activities, had become increasingly difficult. Further evaluation revealed significant peripheral artery disease. The pain was not originating in the muscles themselves. It was originating from inadequate blood flow reaching those muscles during activity. David's experience highlights one of the most common misconceptions surrounding walking-related leg pain. Many people assume that pain means they should reduce activity. In certain situations, that may be appropriate. But in peripheral artery disease, complete avoidance of walking often allows the problem to become worse. This seems counterintuitive at first. After all, if walking causes pain, why would walking ever be considered part of the solution? The answer lies in the body's extraordinary ability to adapt when exposed to the right type of challenge. One of the most remarkable features of the circulatory system is its capacity to develop alternative pathways for blood flow when existing routes become restricted. These alternative pathways, sometimes referred to as collateral circulation, function much like side roads that develop when a major highway becomes congested. Under the right circumstances, the body can gradually improve blood delivery to tissues by strengthening smaller blood vessels and enhancing circulation around narrowed arteries. This process does not occur overnight. It requires consistent stimulation. But when it happens, the benefits can be profound. What many people do not realize is that structured walking has become one of the most extensively studied interventions for peripheral artery disease. Researchers have repeatedly observed that individuals who participate in carefully designed walking programs often improve their walking distance, endurance, and quality of life. The mechanism behind this improvement is not magic, it is physiology. Walking creates a temporary increase in oxygen demand. That increased demand provides a stimulus encouraging the body to adapt. Over time, circulation becomes more efficient. Muscles become better at utilizing oxygen. Alternative blood flow pathways may become more developed. The result is that activities which once produced pain after a short distance gradually become easier to perform. This is where many people make a critical mistake. They interpret pain as evidence of damage when, in certain carefully controlled circumstances, the discomfort may actually represent a signal that the circulatory system is being challenged in a way that promotes adaptation. This does not mean pain should be ignored. It means the context matters. Understanding why the pain occurs is often the first step toward improving it. And yet, despite the growing body of evidence supporting walking as a therapeutic intervention, most people never receive a clear explanation of how to use it effectively. They are told to stay active, but they are not taught why activity matters. They hear that exercise helps circulation, but they are not shown the biological mechanisms responsible for those benefits. As a result, many individuals either push themselves too aggressively or avoid activity altogether, neither of which produces optimal results. In Part 2, I want to explain exactly why walking works as a treatment for circulation-related leg pain, discuss the research that has compared walking programs to other interventions, introduce another patient whose life changed dramatically through a surprisingly simple strategy, and show you how a structured approach to walking can help many adults regain mobility without requiring expensive equipment, gym memberships, or complicated exercise routines. In Part 1, we discussed how peripheral artery disease develops, why pain often appears after walking a predictable distance, and how narrowed arteries can limit the amount of oxygen reaching the muscles of the legs during physical activity. What many people find surprising, however, is that one of the most effective treatments for this condition is not rest. It is not an expensive machine. It is not a specialized piece of equipment, and in many cases, it is not even a medication. The intervention that repeatedly appears in clinical research is something far simpler: walking itself. The idea sounds almost contradictory. If walking creates pain, how could walking possibly become part of the solution? The answer lies in the remarkable ability of the human body to adapt when it is exposed to the right amount of physiological challenge. To understand why walking works, imagine what happens inside the muscles during activity. Every step increases energy demand. Every movement requires oxygen. In a healthy circulation system, blood flow rises to match those demands almost instantly. In peripheral artery disease, the supply cannot increase as efficiently because narrowed arteries restrict circulation. As a result, the muscles experience a temporary mismatch between the oxygen they require and the oxygen they receive. This mismatch produces discomfort. What researchers discovered decades ago, however, is that repeatedly exposing the body to this controlled challenge encourages adaptation. The circulatory system begins searching for ways to improve efficiency. Smaller blood vessels become more effective. Alternative circulation pathways strengthen. Muscle tissue becomes better at extracting oxygen from the blood that is available. Over time, the same activity that once produced pain after a few minutes may become tolerable for significantly longer periods. One of the most important concepts to understand is that the body is constantly adapting to the demands placed upon it. If a person avoids walking entirely because walking causes discomfort, the muscles receive less stimulation, circulation receives less challenge, and overall physical capacity often continues to decline. The result is a cycle that many older adults unknowingly enter. Pain leads to less movement. Less movement leads to weaker muscles and poorer circulation. Poorer circulation makes walking even more difficult. Eventually, activities that once felt effortless begin requiring tremendous effort. The tragedy is that many people assume this decline is an unavoidable consequence of aging when, in reality, a significant portion of it may be influenced by inactivity itself. Research examining structured walking programs for individuals with peripheral artery disease has consistently produced encouraging results. Multiple studies have demonstrated that supervised walking interventions can significantly improve walking distance, walking speed, and overall quality of life. In some cases, participants have doubled or even tripled the distance they could walk before experiencing significant discomfort. What makes these findings particularly important is that the improvements were not dependent on expensive technology. They were the result of a carefully applied physiological stimulus. The body was given a reason to adapt, and over time it responded. I remember a patient I will call Frank, a 73-year-old former school administrator who had gradually stopped participating in many of the activities he once enjoyed. Walking through large stores had become frustrating because he frequently needed to stop and rest. Family outings felt increasingly difficult. Even simple neighborhood walks had become shorter and shorter. By the time he sought medical advice, he had largely accepted the belief that his active years were behind him. During our conversations, he repeatedly described himself as someone whose body was simply wearing out. What struck me was not the severity of his symptoms, but the certainty with which he viewed decline as inevitable. Like many older adults, he had spent years hearing that aging naturally leads to reduced mobility. He had never been told that specific physiological processes might be contributing to his limitations. Once peripheral artery disease was identified, he began participating in a structured walking program designed to challenge his circulation without overwhelming it. The progress was gradual rather than dramatic. There were no overnight transformations, yet month after month, his walking distance increased. Activities that had once required multiple stops became manageable. More importantly, his confidence returned. He no longer viewed movement as something to fear. Frank's experience illustrates an important principle. Improvement often occurs slowly enough that it feels insignificant from day to day. But when those small improvements accumulate over weeks and months, the difference can be substantial. This is one reason many people abandon beneficial interventions too early. They expect dramatic changes and overlook the value of gradual adaptation. Another reason walking is so effective involves its influence on muscle metabolism. Muscles are remarkably adaptable tissues. When exposed to regular activity, they become more efficient at generating energy. They improve their ability to utilize available oxygen. They develop greater endurance. In the context of peripheral artery disease, this means the muscles themselves become better equipped to function despite circulation limitations. The improvement is not solely about blood vessels. It is also about how the muscles respond to the blood they receive. There is also a psychological component that deserves attention. Chronic pain often creates fear. A person experiences discomfort during movement and begins associating activity with danger. Over time, avoidance behaviors develop. They walk less, they exercise less, they become increasingly cautious. While this reaction is understandable, it can sometimes become part of the problem. Structured walking programs help restore confidence by demonstrating that movement remains possible.